Good morning, students. Today's lecture is on epidemiology of hypertension. These are the learning outcomes. At the end of this session, the students should be able to define and classify hypertension, describe the magnitude of the problem globally, describe the magnitude of the problem in Malaysia, describe various risk factors of hypertension and various strategies to control those risk factors. Describe how the burden of hypertension can be reduced using prevention and control strategies globally and in Malaysia. Now we can go through what is blood pressure. Blood pressure is a force exerted by circulating blood against the walls of the body's arteries, which are the major blood vessels in the body. Systolic blood pressure represents the pressure in arteries when the heart contracts or beats. That is the pressure in arteries during systole. That is systolic blood pressure. Diastolic blood pressure is the pressure in arteries during diastole. That is when the heart rests between beats. Hypertension is when blood pressure is too high. Hypertension is diagnosed if it is measured on 2 different days. The systolic blood pressure readings on both days is more than or equal to 140 millimeter of mercury, and or the diastolic blood pressure readings on both days is more than or equal to 90 millimeter of mercury. That is a definition of hypertension. These are the classification of clinical blood pressure levels in adults. Clinic blood pressure levels in adults. Optimal is when systolic blood pressure is less than 120 millimeter mercury and diastolic blood pressure is less than 80 millimeter of mercury. That shows that 30.7% of adults in Malaysia are having optimal blood pressure according to the clinical practice guidelines Academy of Medicine of Malaysia studies. Normal blood pressure is when systolic blood pressure is between 120 and 129 millimeter of mercury and or diastolic blood pressure is between 80 and 84 millimeter of mercury. Studies shows that 25.3% of adults in Malaysia are having normal blood pressure. That shows that combinedly 56% of Malaysian adult population are having either optimal or normal blood pressure level. At risk blood pressure is when systolic blood pressure is between 130 and 139 and or diastolic blood pressure is between 85 to 89. And 18.6% of adult population in Malaysia are having at-risk blood pressure. Now we can move on to hypertension. Hypertension can be classified into stage 1, stage 2 and stage 3. Stage 1 is mild hypertension, stage 2 is moderate and stage 3 is severe. And apart from these three, isolated systolic hypertension is also there. Stage 1 or mild hypertension means systolic blood pressure is between 140 and 159 millimeter of mercury and or diastolic blood pressure is between 90 and 99 millimeter of mercury. 17.3% of adult population in Malaysia are having stage 1 or mild hypertension. Stage 2 hypertension or moderate hypertension means systolic blood pressure is between 160 and 179, and or diastolic blood pressure is between 100 and 109. The 5.7% of adult population in Malaysia are having moderate hypertension. Third category is stage 3 or severe blood pressure, severe hypertension. That means systolic blood pressure is more than or equal to 180 and or diastolic blood pressure is more than or equal to 110. Studies shows that 2.4% of adult population in Malaysia are having severe or stage 3 hypertension. Isolated systolic hypertension is when systolic blood pressure is more than or equal to 140 and diastolic blood pressure is less than 90 millimeter of mercury. And 11.2% of adult population in Malaysia are suffering from isolated systolic hypertension. These are the various classification and the prevalence of each group. Criteria for staging hypertension based on clinic, home and ambulatory blood pressure monitoring. According to Clinical Practice Guideline of Malaysia, stage 1 hypertension is when blood pressure is measured in clinic if it is more than or equal to 140 millimeter of mercury systolic or 90 millimeter mercury diastolic. That is stage 1 hypertension. And home BP monitoring or ambulatory BP monitoring should be more than or equal to 135 millimeter mercury systolic and 85 millimeter mercury diastolic comes under stage 1 hypertension. Stage 2 hypertension in clinic if it is more than or equal to 160 millimeter mercury systolic or 100 millimeter mercury diastolic. That is stage 2 hypertension in clinic. Stage 2 hypertension in home or ambulatory BP monitoring if it is more than or equal to 150 millimeter mercury systolic and 95 millimeter mercury diastolic. That is stage 2 hypertension in home or ambulatory setting. Severe hypertension is when clinic blood pressure monitoring systolic blood pressure is more than or equal to 180 or diastolic blood pressure more than or equal to 110. It is adopted from National Institute for Health and Clinical Excellence Hypertension in 2011. Now we can move on to epidemiology of hypertension. Epidemiology of hypertension can be classified or presented under subheadings: magnitude of the problem globally and in Malaysia, risk factors for hypertension, complications of hypertension, strategies to control risk factors, strategies for prevention of hypertension, strategies for control of complications of hypertension. Magnitude of the problem globally. Hypertension is a hidden disease, or in some literature it is shown as hidden killer disease. Okay, many of those with hypertension are undiagnosed. So if you take a community in a public place, many may be hypertensive, but they are not aware of their hypertensive status. Mortality rates of various cardiovascular diseases in high income and low income countries. In high income countries, mortality due to cardiovascular diseases is high, but In lower income countries, mortality rates due to cardiovascular disease are higher than in high income countries. So in this graph it is shown cardiovascular disease death rate each standardized per 100,000 population. These red bars are showing high income countries and blue bars are showing low income countries. From the graph itself we can see that low income countries are having higher mortality rates. Low income countries include Afghanistan, Somalia, Malawi, Zambia and all, shown as blue bars, are having higher mortality rates due to cardiovascular diseases. These red lines show high income countries like Oman, Saudi Arabia, Hungary and all. They show mortality rates of cardiovascular disease are lower compared to low income countries. Magnitude of problem globally. It shows that these show the projected mortality trend from 2008 to 2030. In 2008 also, mortality due to cardiovascular disease was around 18%. In 2015, it became around 20%, and it is projected to be around 24% in 2030. Due to cancer also it is increasing, but other communicable diseases are on the lower stage. Magnitude of the problem globally. We can go through top 10 causes of death globally in 2016. It shows that ischemic heart disease is the highest, topmost cause of death, followed by stroke. Okay, so our topic is today on hypertension. Hypertension is a risk factor for ischemic heart disease and stroke. And ischemic heart disease and stroke are the top 1 and 2 causes of deaths globally. So hypertension is a major risk factor for mortality due to ischemic heart disease and stroke. Magnitude of the problem globally. Top 10 causes of death in low income countries. In low income countries, third topmost cause of death is ischemic heart disease, and the fifth topmost cause of death is also stroke. So third and fifth top cause of death in low income countries are due to hypertension, because hypertension is a major risk factor for ischemic heart disease. Hypertension is a major risk factor for stroke also. In lower middle income countries, if you take lower middle income countries, top 2 causes. First cause is ischemic heart disease. Top cause of death is ischemic heart disease. Second top cause of death is stroke. So hypertension is leading to 2 topmost causes of death in lower middle income countries. If you take upper middle income countries also, topmost 2 causes are ischemic heart disease and stroke. Hypertension is the major risk factor for those 2 topmost causes of death, which are ischemic heart disease and stroke. If you take high income countries, as already shown, high income countries also, ischemic heart disease and stroke are the top 2 causes of death. So hypertension is leading to top 2 causes of death. So now you understood how influential the hypertension in causing ischemic heart disease, stroke and mortality due to ischemic heart disease and stroke. Now we can go through the common non-communicable diseases in Malaysia. So many non-communicable diseases in Malaysia, and the topmost non-communicable disease is diseases of the circulatory system. So we can know hypertension is a major risk factor for circulatory system diseases like ischemic heart disease, coronary artery disease, cerebrovascular disease, stroke, all these things. Stroke itself can be ischemic stroke or hemorrhagic stroke. Hypertension is a risk factor for both ischemic stroke and hemorrhagic stroke. How hemorrhagic stroke is caused? Hypertension increases the blood pressure inside these small arteries in brain. That increased blood pressure can lead to aneurysm, and aneurysm can break and can cause hemorrhagic stroke. How it can cause ischemic stroke? Hypertension can lead to atherosclerosis inside these small blood vessels of brain. That atherosclerosis can lead to ischemia to different part of brain. So diseases of the circulatory system is the topmost non-communicable disease in Malaysia. So hypertension is leading to diseases of circulatory system. Now, fourth topmost non-communicable disease fourth one is ischemic heart disease. So hypertension is a risk factor for ischemic heart disease. 3,184 cases per year during 2017. Okay. And 9.93 per 100,000 population is the incidence rate. Okay, number of cases per 100,000 population. That is 9.93 cases per 100,000 population for ischemic heart disease. If you look at fifth common non-communicable disease, that is cerebrovascular disease. Cerebrovascular disease include stroke, ischemic stroke and hemorrhagic stroke. So 3,184 cases in 2017. Okay, 3,177 cases. The 9.91 cases per 100,000 population. And please look at 10th non-communicable disease in Malaysia, 10th common, that is hypertensive disease. That itself is causing so many other 1,193 cases of hypertension and 3.72 per 100,000 population. Now we can go through various non-communicable disease risk factors in Malaysia. Okay, these are the major non-communicable disease risk factors: diabetes mellitus, hypertension, hypercholesterolemia, overweight, obesity, physical activity, smoking, and alcohol use. Okay, so if we focus on hypertension, in 2006, 32.2% of population were having hypertension, and in 2011 it became 32.7. It is increasing, and in 2015 it came down to 30.3. Hypertension is reducing a bit by 2015, but diabetes is on an increase. It was 11.6% during 2006, it became 15.2% in 2011, and it became 17.5% during 2015. Hypercholesterolemia is also increasing. It was 28.2% during 2006, it became 43.9% in 2011, and 47.7% in 2015. So we will focus on hypertension. It is 32.2, 32.7 in 2011 and 30.3 in 2015. It's a major non-communicable disease risk factor. Okay, smoking is also 21.5% in 2006, 23.1% in 2011 and 22.8% in 2015. Now we can look at the various non-communicable risk factors, non-communicable disease risk factors in Southeast Asia. Okay, so high blood pressure is a major risk factor, raised blood pressure, high blood sugar level, raised total cholesterol level, obesity, smoking and physical inactivity. By looking at this table, 9.9% during 2014 was having high blood sugar levels. 22.1% of people, adults, were having increased blood pressure, raised blood pressure. 15.4% in 2008 were having raised total cholesterol. Obesity was 13.3% in 2014. Smoking was 21.9% in 2011. And the physical inactivity was also one risk factor. In 2010, it was 52.3%. So when we compare with other countries in Southeast Asia region, Malaysia is having higher level of non-communicable disease risk factors. Higher than Singapore, Thailand, okay, and many other countries. Only Brunei is having higher level of non-communicable disease risk factor compared to Malaysia. Okay. Now we can look at the magnitude of the problem in Malaysia. Okay. Mortality attributable to risk factors in Malaysia. Okay. So we can say that left side is that a blue color is for males and right color, that light brown color is for female. Okay, so we can find high blood pressure is attributing to 19.4% of mortality among males. Okay, 19.4% of mortality among males were due to high blood pressure, and 22.8% of high mortality among females were attributable. Attributable means was due to high blood pressure. Tobacco use. 15.7% of mortality among males was due to tobacco use, while only 1.2% of mortality among female was due to tobacco use. Like that. So you understood 19.4% of mortality among males and 22.8% of mortality among females was due to high blood pressure. Okay, now we can look at the DALYs. DALYs means what? Disability adjusted life years. How much of productive life is lost? Okay, sum of years of potential life lost due to premature mortality and years of productive life lost due to disability. So how many years lost due to premature mortality? Okay, if in Malaysia 75 is the life expectancy, so everyone is expected to live up to 75 years of age. So if a person is dying at the age of 60 years, that means 15 years are lost due to premature mortality. If a person is getting hypertension at the age of 50 years and he dies at the age of 65 years, so from 65 to 75, 75 to 65, 10 years lost due to premature mortality, and 65 year to 50 years, so 15 year lost due to disability due to disease, because he was diagnosed as hypertensive at the age of 50 years. 50 year to 65 year he was living with a hypertension but in a disabled stage. 65 year he lost his life. So up to 75 year. So 10-year loss due to premature mortality. So DAL is lost. Okay, DAL means disability adjusted life year. How many years lost due to premature mortality plus how many years lost due to disability. Okay, how many years of productive life lost due to disability. In this case, 10.8% of DALYs, that is disability adjusted life years, were attributed by high blood pressure. 10.8% of DALYs of males were attributable to high blood pressure. 10.8% of DALYs of females were attributed to high blood pressure. So high blood pressure reduces the life, can lead to premature mortality, and can remove the productive life by making people disabled or diseased. Understood? Now we can go through the risk factors for hypertension. Risk factors can be divided into different categories: social determinants and drivers, that is social risk factors. Then comes behavioral risk factors. Some are behavioral risk factors. Then comes metabolic risk factors. Then it can lead to various diseases, that is complications of hypertension. So what are the social risk factors, social determinants? Globalization. Globalization means everyone is working together. All countries are working together. So it adds to stress. Okay, when American office is open, those in Malaysian office will work at the same time. When a Russian office or a European office is open, then also Malaysian people has to work. So that's globalization adds to so much stress. Urbanization. Urbanization brings more industries and people are working more according to the industries. Okay. Aging. Because more people are getting aged, they get hypertension and a disease. So globalization brings stress, urbanization brings stress, aging brings disease, hypertension because of aging. Income, high income and low income. High income can bring so many unhealthy habits like unhealthy diet, unhealthy lifestyle, that can lead to hypertension. Low income can lead to stress and can lead to hypertension. Education. High education can bring luxurious life and a better life. So unhealthy lifestyle may be there. Low education can also lead to unhealthy lifestyle. They don't know what lifestyle is good. Housing. Better housing can lead to luxurious lifestyle. Poor housing can bring stress. Both can lead to hypertension. So globalization can bring stress, urbanization, overwork and stress, aging can lead to age-related disease, income, high income can lead to unhealthy lifestyle, low income can lead to stress and unhealthy lifestyle. Education, high education can lead to luxurious life and unhealthy life, sometimes healthy life. Okay, low education can lead to stress and unhealthy lifestyle. Okay, these all are social risk factors of hypertension. Now we will go to behavioral risk factors. What is behavioral risk factors? Includes unhealthy diet, tobacco use, physical inactivity, and harmful use of alcohol. Unhealthy diet, consuming more salt, more fat, more calories. Okay, that can lead to obesity and overweight and hypertension. Tobacco use, more tobacco use can lead to hypertension. Physical inactivity can lead to obesity or overweight and hypertension and other non-communicable disease. Harmful use of alcohol. Alcohol users take more unhealthy diet along with that, and they use tobacco also along with that, so that can lead to hypertension. Now we will go to metabolic risk factors. What are the metabolic risk factors? High blood pressure. High blood pressure is a metabolic risk factor for non-communicable disease. Obesity is a metabolic risk factor. Diabetes is a metabolic risk factor. And raised blood lipids. Okay, hypercholesterolemia or hyperlipidemia. So high blood pressure, obesity, diabetes and hyperlipidemia. These are the metabolic risk factors. It can lead to what all diseases? Cardiovascular disease like heart attack, stroke, heart failure, okay, and kidney disease. Have you heard of hypertensive nephropathy? Kidney disease because of hypertension. That is hypertensive nephropathy. Have you heard of hypertensive retinopathy? That is eye disease because of hypertension. That is, hypertension can lead to breaking and injury to the blood vessels of retina. Okay, and retinal exudates will be there when you are doing fundoscopy examination. Retinoscopy examination, you can see blood vessels getting damaged. It can lead to eye disease known as hypertensive retinopathy. Okay. Then now we can go through risk factors for hypertension. There are so many risk factors for hypertension. Already we saw social risk factor, behavioral risk factor, metabolic risk factor, which can lead to various diseases. Understood? Now we can, another classification is modifiable risk factor and non-modifiable risk factor. Modifiable risk factor means which can be modified by us. Unhealthy diet can be modified. If you make the diet healthy, you can prevent hypertension. What are the unhealthy dietary behaviors? Excessive salt consumption. Okay, salt contains sodium, right? Excessive sodium can lead to hypertension. Excessive salt consumption and excessive sodium consumption. Then a diet high in saturated fat and trans fat. Saturated fat means more amount of ghee, more amount of butter, more amount of vegetable oils like coconut oil, okay, more amount of animal fat, like if you are taking red meat contains more amount of fat, animal fat. All these are saturated fat. What is trans fat? You know, the fat present in hydrogenated vegetable oil like planta or dalda, like that. All these contain trans fats. Fast food contain more amount of trans fat. Trans fat is very dangerous. It can lead to hypercholesterolemia, hyperlipidemia, hypertension. Low intake of fruits and vegetables. That is also one risk factor, modifiable risk factor for hypertension. Now we will move on to next modifiable risk factor, physical inactivity. Okay, no exercise, no movement, no jogging, no walking, no games. All these are physical inactivity, can lead to hypertension. Harmful use of tobacco. Okay, tobacco contains nicotine. Nicotine can lead to high blood pressure and cardiovascular illness. Harmful use of tobacco. Harmful use of alcohol. Whenever a person is taking alcohol, they used to take high fat diet and unhealthy diet along with that. And many people use tobacco along with alcohol. So both add on to each other. or harmful use of alcohol is also a modifiable risk factor. Being overweight or obese, physical inactivity can lead to overweight or obese. Unhealthy diet can lead to overweight or obese. Excessive saturated fat, excess calories, excess salt consumption, all these can lead to overweight and obese. Non-modifiable risk factors. There are so many non-modifiable risk factors such as family history of hypertension. Pregnancy. Pregnancy is a non-modifiable risk factor. The risk of having hypertension is higher during pregnancy. Age over 65 years. And various coexisting diseases such as diabetes or kidney disease can lead to, these are non-modifiable risk factor for hypertension. Now we can go through the complications of uncontrolled hypertension. Okay, first complication is ischemic heart disease. Okay, most common complication of hypertension is ischemic heart disease. It can lead to myocardial infarction, angina pectoris, or acute coronary syndrome. Myocardial infarction means it can cause infarction of myocardial tissue due to lack of blood flow to some myocardial tissue. That is myocardial infarction. It can lead to death of myocardial tissue. Angina pectoris is a chest pain due to reduced blood flow to myocardial tissue. Acute coronary syndrome. Okay, reduced blood flow to myocardium, it can lead to produce ECG changes like ST segment elevation, T wave inversion, all these can be caused. Okay, it's a complication of uncontrolled hypertension, myocardial infarction, angina pectoris, acute coronary syndrome. And if not treated or not controlled, it can lead to cardiac failure, congestive cardiac failure also. Second complication is hypertensive nephropathy. Hypertension can lead to kidney disease, kidney failure. It is known as hypertensive nephropathy. Then third complication is hypertensive retinopathy. As told earlier, hypertension can lead to injury of blood vessels in retina and can cause blindness. That is known as hypertensive retinopathy. Stroke. Hypertension can lead to stroke. What are the type of strokes you know? One is ischemic stroke and hemorrhagic stroke. Ischemic stroke means because of ischemia. How ischemia is caused? Blood vessels gets narrowed because of atherosclerosis. Hypertension can lead to atherosclerosis of small blood vessels in brain. So because of atherosclerosis, it can cause reduced blood flow to some areas of brain. It can lead to ischemic stroke. How hypertension can lead to hemorrhagic stroke? Okay, because of high blood pressure inside the blood vessels, it can lead to aneurysm. Blood vessel get expanded or dilated, and still blood pressure is high, the dilated blood vessel may break. That is known as rupture of blood vessel. It can lead to hemorrhagic stroke. So these are the complications: ischemic heart disease, cardiac failure, hypertensive nephropathy, hypertensive retinopathy, and stroke. Okay, how can the burden of hypertension be reduced? Okay, reducing hypertension prevents heart attack, prevents stroke, prevents kidney damage, as well as other health problems. How we can prevent hypertension? There are so many ways. One is reducing salt intake to less than 5 gram per day. So reduce the salt intake to less than 5 gram per day. We discussed earlier that sodium in salt is dangerous, right? sodium, amount of sodium should be less than 2.5 gram per day. So we have to reduce the salt, amount of salt to less than 5 gram per day. How we will measure 5 gram? 1 teaspoon is 5 gram. So reduce the salt intake to less than 1 teaspoon or less than 5 gram. Eating more fruits and vegetables. Okay, that's the second way to prevent. Third one, being physically active on a regular basis. Regular physical exercise. Regularly active on jogging, walking, cycling and all. Avoiding use of tobacco. Tobacco contains nicotine. Nicotine leads to hypertension. So avoid using tobacco. Reducing alcohol consumption. Okay, alcohol consumption can also lead to hypertension. Limiting intake of food high in saturated fat. So earlier we discussed saturated fat and trans fat. Both can lead to hypertension. So limiting intake of food high in saturated fat and reducing trans fat, that is hydrogenated vegetable oils in diet. Hydrogenated vegetable oils are dangerous. So you have to check the instructions. If it is containing trans fat, we have to reduce it. Now, how hypertension can be reduced? Burden of hypertension by management. How we can manage hypertension? Reducing and managing mental stress. If a person is stressed, we have to reduce stress by proper time management, proper life management, okay, proper financial management. We can reduce this stress by doing some recreational activity, exercise, socialization with the friends. All these can reduce mental stress. Regularly checking blood pressure. Second is we have to check blood pressure regularly. Why to check regularly? To identify hypertension. After identifying hypertension, we have to treat if high blood pressure is there. Treat with medication. There are multiple. Lifestyle modification is there, dietary modification is there, then pharmacological treatment is there. Lifestyle modification, being physically active, reducing high calorie, high fat diet, reducing high salt diet, all these things. Okay, pharmacological treatment, there are so many medicines like beta blocker, calcium channel blocker, ACE inhibitor. There are multiple medications are there for reducing high blood pressure. Managing other medical conditions. If a person is having kidney disease, we have to control it. Otherwise, it can lead to hypertension. Okay, next strategy is tobacco control policy. Tobacco control policy, monitor tobacco use and prevention policies. Okay, government has strict rules. No use of tobacco in public place and protect people from tobacco smoke. So if somebody is smoking in public place, they will be fined and they will get punishment. Offer help to quit tobacco use. If a tobacco user want to quit, Ministry of Health help them with nicotine patches, nicotine gums and other behavior therapy will be given to quit tobacco. Warn about dangers of tobacco. In all tobacco products it will be given. Tobacco can cause cancer. Tobacco can kill the person, like that. Enforce bans of tobacco on tobacco advertising, promotion and sponsorship. So nobody is allowed to advertise tobacco in TV or radio like that. Raise taxes on tobacco. Tobacco price is increased so that less people will buy it. Okay, for a smoke-free generation. And another rule is there. Those who are below 18 years cannot buy tobacco products. They will not sell to children below 18 years of age. So that also, this all comes under tobacco control policy. Then active living. There are some policies for active living. It is known as NASPAL. What is that NASPAL? You know, National Strategic Plan for Active Living. Okay, what are they? To strengthen public policies that support active living. People has to be active. To expand appropriate environment. So many parks will be there. So people can walk, people can cycle, and people can be active in various exercise machines will be there. To increase public motivation and understanding through public education. In TV and radio, messages will be there. Benefits of doing exercise, what all diseases can be prevented, and to be healthy and active. To intensify behavior change programs. So, government will do so many activities to promote cycling, promote physical activity, promote doing marathon and jogging and all. Like car free day is there, Hippo car free day. It promotes people to walk and run and be active. To enhance partnership and collaboration. So various non-governmental agencies like a World Health Organization and other agencies work together with Ministry of Health to make people more physically active. To strengthen evaluation, monitoring and research. Evaluation means various activities to make people physically active. Is it working or not? Monitoring. How many people are using the exercise machines, using the gym, using the park, like that. That's a monitor and attract more. There will be a children playing area along with the adult playing area. So adults will bring kids also to play there. Okay, research. We have to identify why people are not using the activity, why people are more active or less active. That we need to identify. Then we can promote people to be more active. Next strategy is salt reduction strategy to prevent and control non-communicable disease for Malaysia. As already told, salt reduction is very important. Okay, daily intake of salt should be less than 5 gram per day according to World Health Organization. So in Malaysia they have done a study and found out that Malaysians consume 8.7 gram of salt per day. Okay, and Malaysia government decided to reduce by 30%. Okay, now people are using 8.7 gram of salt per day. It should be reduced to 6 gram per day by 2025. Okay. So Malaysia government plans to for 30% reduction of average salt intake. Now average salt intake is 8.7 gram per day. It should be reduced to 6 gram per day by the year 2025. That's a salt reduction. Why we are reducing salt? By reducing salt intake, we can reduce sodium intake. By reducing sodium intake, blood pressure can be reduced. Understood? So now the last strategy is prevention of harmful use of alcohol. That is 2013 to 2020 National Action Plan. Okay, so what are the strategies are based on these public health principles? First is strengthening health campaigns. What are the themes of health campaign? You know, healthy without alcohol, socialization without the use of alcohol. Okay, meet people, talk with people, be happy with people, but without using alcohol. Healthy, being healthy without using alcohol. Okay, reducing the risk and impact of harmful use of alcohol. So, more amount of alcohol can lead to cardiovascular illness, can lead to hypertension. So, reducing the risk and the impact of harmful use of alcohol. Limiting the availability of alcoholic beverages. Government has made some restriction. Alcoholic beverages are not available to all or not available in all shops. It is limited. Sustainability of the prevention and harmful use of alcohol programs. There should be so many government programs, okay, for prevention of harmful use of alcohol programs. Okay, so these are the activities. Thank you. Thank you. Visit our YouTube channel, Public Health Research Videos, Dr. Sandeep.